If your gums bleed when you brush, your body is not being dramatic, it's filing a complaint. Because bleeding gums aren't normal. They're closer to an open wound, in the one place you chew, swallow, and introduce bacteria into your bloodstream every single day. And here's the part nobody talks about. Your mouth is not separate from your heart. In late 2025, the American Heart Association put out an updated scientific statement highlighting the growing evidence linking periodontal disease with atherosclerotic cardiovascular disease. They also emphasized the honest truth. The association is strong, the mechanisms are plausible, and we still need more hard outcome trials proving fewer heart attacks. But you and I don't need perfect certainty to do the basics. Because the basics protect your teeth anyway, and your heart might stop paying interest on gum inflammation. Today I'm going to show you the oral microbiome link you're ignoring, how to spot gum disease early, and a fast, practical protocol to fix it. No gimmicks, no special mouth detox tea, and no, you don't need to gargle moonlight. Quick disclaimer, this is educational, not medical advice. If you have major bleeding, loose teeth, or heart conditions, work with your dentist and clinician. Now let's make this simple. There are two gum problems that matter. Gingivitis is the early stage. Your gums get red, puffy, and bleed easily, but with consistent hygiene and cleanings, it's often reversible. Periodontitis is the deeper stage. That's when infection and inflammation create pockets between tooth and gum, and over time you can lose bone support. Here's what makes periodontitis sneaky. It can be quiet for years. No drama, no pain, no warning siren. Just a slow leak of bacteria and inflammatory signals into your system. And it's not rare. Tens of millions of adults have it, and prevalence rises with age, smoking, and diabetes. That's why so many people normalize it. Yeah, my gums always bleed a little. That's like saying, yeah, my smoke alarm always beeps a little. It's not quirky, it's a message. So how does a gum problem turn into a heart problem? Let's build the case like a scientist, not like a sales page. First, the association. Across many observational studies and meta-analyses, people with periodontitis show higher rates of cardiovascular events like heart attack and stroke, even after adjusting for common risk factors. That doesn't prove causation. But it tells us the signal is consistent enough to take seriously. Second, the mechanism stack. This is where it gets interesting. Mechanism 1 is bacteremia. When gums are inflamed, even normal activities like chewing and brushing can allow oral bacteria to enter the bloodstream more easily. And researchers have detected oral pathogens in atherosclerotic plaque. Think of it like this: when the gum barrier is damaged, stuff that belongs in the mouth gets access to places it doesn't belong. Mechanism 2 is systemic inflammation. Periodontitis isn't a one-day infection, it's a chronic inflammatory condition. That means inflammatory markers can rise and stay elevated. And chronic inflammation is basically the background music of atherosclerosis. Mechanism 3 is endothelial dysfunction. Your endothelium is the inner lining of your arteries, and when it's irritated, it gets worse at regulating blood flow and vascular tone. Multiple reviews suggest periodontal treatment can improve surrogate markers like inflammation and measures of endothelial function. Not guaranteed for everyone, but directionally consistent enough to matter. Now here's the twist that makes this video different from the usual brush and floss lecture. Your mouth bacteria are not all villains. Some of them are actually helpers. Specifically, certain oral bacteria convert dietary nitrate from foods like arugula and beets into nitrite, which your body can use to make nitric oxide. Nitric oxide helps blood vessels relax. That's one reason nitrate-rich veggies are often linked with better vascular function. So what happens if you sterilize your mouth every day like it's a crime scene? You might knock down those helpful nitrate-converting bacteria. In a short human study, using strong antibacterial mouthwash reduced oral nitrate reduction and was associated with a small rise in blood pressure. Not a reason to panic, just a reason to be smart. The goal is not kill everything. The goal is restore balance. So let's get practical. Here's the longevity compass, fix it fast, protocol, and it's built for real life. Step 1 is the gumline rescue routine. Twice a day, brush like your gumline is the target, not an innocent bystander. If you can, use an electric toothbrush because it reduces the skill requirement. We love skill, but we also love outcomes. Take 2 minutes. Spend extra time where tooth meets gum, because that's where biofilm likes to squat. Step 2 is daily interdental cleaning. Floss, interdental brushes, or a water flosser as an add-on. Pick the one you'll actually do consistently. If your gums bleed when you floss, don't interpret that as flossing is dangerous. Interpret it as the tissue is inflamed. Bleeding often improves with consistent, gentle technique. But if you have periodontitis, home care alone may not be enough, and we'll get to that in a second. Step 3 is tongue cleaning. Your tongue is a bacterial airport runway. A tongue scraper takes about 5 seconds and can reduce that "why do I taste my own biography" feeling in the morning. It also helps breath, which your friends and family will pretend doesn't matter, while standing slightly farther away. Now step 4 is mouthwash rules, and this is where people go off the rails. Antiseptic mouthwash is a tool, not a lifestyle. If your dentist prescribes something like chlorhexidine, that's usually for a short course for a specific reason. Using strong antibacterial rinse daily, long-term, without guidance is like taking antibiotics, just in case. If you want a routine rinse, think in terms of your goal. If your goal is cavity protection, a fluoride rinse may make sense. If your goal is gum healing, the foundation is mechanical plaque removal. Brush and interdental cleaning are the main event. Everything else is a supporting actor. Step 5 is the unsexy move that changes your trajectory. Get a periodontal evaluation. Not just, looks okay. Ask for probing depths and bleeding on probing. Ask whether you have gingivitis or periodontitis, and what stage. If periodontitis is present, professional treatment like scaling and root planing is often what actually shifts the trajectory. Home care manages it, but it may not fully reset it once pockets and bone loss exist. Now step 6 is lifestyle leverage, because your gums live downstream of your environment. If you snack on sugar and ultra-processed foods all day, you're basically running a buffet for plaque bacteria. It's not about being perfect, it's about reducing frequency. Eat real meals. Cut the constant grazing. Stop smoking or vaping if you do, because it's a major risk factor for periodontal disease. And here's the nasty trick. Smoking can reduce bleeding even while damage continues, so you get less warning while things get worse. If you have insulin resistance or diabetes, tighten glucose control. Gum disease and metabolic dysfunction amplify each other. Okay, quick segment on extras, because I know someone is going to ask about supplements. Supplements don't replace plaque removal. They're support, at best. Some evidence suggests omega-3s may provide modest benefit as an adjunct to professional periodontal therapy in some studies. Probiotics have mixed results. Some trials show improvements in gum parameters as an add-on, but durability varies. CoQ10 has inconsistent evidence and isn't a slam dunk. And let's talk about xylitol, because this is where nuance matters. Xylitol gum has been studied for oral benefits, and sugar-free gum can help reduce caries risk in some contexts. But in 2024, a paper reported higher circulating xylitol levels were associated with higher cardiovascular event risk, with mechanistic clotting signals. That doesn't automatically mean normal xylitol gum causes heart attacks. It does mean I wouldn't treat xylitol like a lifestyle food group. If you use it as a targeted dental tool, not keto candy season. Now, 2 safety notes that make you sound like the responsible adult in the room. First, if you have severe bleeding, loose teeth, facial swelling, fever, or pain, don't DIY. Get evaluated. Second, infective endocarditis prophylaxis. Most people do not need antibiotics before dental procedures. But a small group of high-risk heart conditions may require it for certain procedures, and the guidelines have evolved. So if you have a history of valve disease, prior endocarditis, or complex congenital heart disease, ask your cardiologist and dentist what applies to you. Now let's bring it home with a simple 7-day challenge that can change your baseline fast. For the next week, do 2 minutes of gumline-focused brushing twice a day. Do interdental cleaning once a day. Tongue scrape once a day. And write down just one thing: do your gums bleed less by day 7? Because for many people, they do. If you want the full upgrade, book the periodontal evaluation and get actual pocket measurements. Data beats vibes, even in your mouth. And here's the longevity takeaway. You don't get to pick the fun, health habits and ignore the boring ones. Because the boring ones are usually the ones that quietly protect you for decades. If you take care of your gums, you're not just saving teeth. You're reducing a chronic inflammatory burden that your cardiovascular system has to live with. If this helped, tap like, subscribe, and share it with the person who thinks flossing is optional. Don't forget our longevity compass book is linked in the description. And remember, the goal isn't just living longer. It's living longer with your heart strong, and your teeth still on speaking terms with your gums.